Hey class, in the previous videos, we have introduced the functions of acupuncture and moxibustion. In this video, we are going to study the principles of the treatment. Chinese medicine and acupuncture emphasize the principles of acupuncture and moxibustion, as only you follow the principles, you will see the efficacy of your treatments, as well as only you follow these principles, you won't make mistakes in your treatments. So this is one is to safeguard your practice. The second is to see the efficacy of your treatments. Sometimes you will see there are actually many people, they criticize that Chinese medicine, including acupuncture, we treat patients individually, even with the same patient. Different practitioners may use different formulas, different herbs, and different acupoints with the same patient, the same diseases at the same time. Different practitioners may use very different treatments. That's why some people, they always criticize that if a patient comes to 10 different practitioners, the patient may get 10 very different prescriptions, even with the same disease. So this is actually the fact. So we don't deny that the phenomenon of different prescriptions. But if someone criticizes in the different prescriptions or different points in the prescriptions towards one disease, if they criticize this, which means they don't understand the principles of our treatments. As we discussed previously, with our treatments, no matter from herbal medicine or acupuncture and moxibustion, we focus on the symptoms. We more focus on the pathogenesis, the cause of these symptoms. Our treatments will base on the causes. And then when we treat the cause, for example, the cause may be excess heat. In this situation, once you diagnose the patient with excess heat, you need to apply the treatment principles and then followed by the herbs or acupoints. So the gap between the pathogenesis and the treatments, there are some principles in between. These principles are something we need to follow. And also, because we follow, if only you follow the principles, the treatment is correct, even though we got different treatments. Because as long as you follow the principles, you will see some efficacy. Obviously, the efficacy may vary from different practitioners, though this will depend on your skills and your experience. But as long as you follow the principles, you are correct. That's why we emphasize the principles of the treatments. This is also has been emphasized since the classic 黄帝内经. All these principles that we are discussing here were from 灵书, the second volume of 黄帝内经. Sometimes we may misunderstand or we may confuse. How can you say that in a treatment with the same patient with the same disease at the same time, you can use very different treatments to that patient, and all treatments is considered as correct as long as they follow the principles? How can that be possible? So in this situation, we can think about the phenomena. For example, I want to drive from Johannesburg to Pretoria. Okay, I want to drive from University of Johannesburg to Pretoria. When you drive to Pretoria from this direction, The principle in this moment is you need to drive from south to the north. Your direction should be towards the north, so you can choose the highway. So you can drive there within 1 hour. You can drive in the normal road. It takes much longer, but you still can arrive Pretoria. You also can drive slightly to the east or west and then to the north. It may take much longer time to arrive. But see, in these phenomena, no matter which way you choose, you can arrive Pretoria if you drive from Johannesburg. But if you drive to the south, to the west, to the east, you won't arrive, because this is the principles. The direction, the principles, we can say that's the directions of your treatments. Patients suffer from excess heat. Your direction is to clear the heat. So in this situation, you may think about, if a patient suffers from excess heat, should I choose Moxibustion? If you choose Moxibustion, you might make mistakes in the principles, because the Moxibustion can increase the heat, can make the symptom worse. But if you understand the principles of excessive heat is to clear the heat, then I can choose large intestine 11. I can choose the lung 11 or do 14, GV14. So as you can see here, if you understand the principles of this patient for excess heat, it's clearing the heat. You may use large intestine 11, you may use lung 11, large intestine 1, 少商 Sangyang. So if the number, I memorize the wrong number, you can just try to memorize to confirm with the Chinese name. Shaoshang, Sangyang, the points on the fingertip of your thumb and the index finger. So the points on the lung meridian and the large intestine meridian. You can use do 14, 大椎. You can prick to cause bleeding. These treatments can reduce the heat in the body. No matter which one you use, all of them can reduce the heat in the body, which means your treatments are correct. That's why with the same patient, different practitioners may have very, very different treatments, very different prescriptions, acupoints in the prescriptions, but all of them are considered as correct. As long as you follow the principles, you will see some efficacy. That's why the principles are very important. Since the principles are so important, how many principles that we have to follow during our treatments? There are mainly 3 principles that we need to follow during our treatments, which are cultivating the sun or spirit and maintaining the qi, clearing the heat and warming the coldness, tonifying the deficiency and expelling the excess. All these principles are from the classic. More specifically, most of them are from Lin Shu, the 2nd volume of the classic. Lin Shu has another translation when you search on Google, spiritual pivot. This is another reason why we prefer to keep the Chinese name. Lin Shu, that's the 2nd volume of the classic, but when you see from the translation, spiritual pivot, it's very easy to misunderstand this book. It's focusing something on spiritual. Cultivating the sun or spirit. As we mentioned previously, in Chinese medicine, there are no spirit. Although we use the same words as spirit in Chinese, 神, The meaning of the sun is very different from spirit. It doesn't relate to spirit at all. That's why in the basic theory, we choose the mind instead of spirit, which means here cultivating the spirit also actually is cultivating the mind, cultivating the mental activities, psychological activities, and maintaining the qi. Cultivating the spirits or cultivating the mind is one of the most important principles that we need to follow. Cultivating, we also can use maintaining, so maintain the mind, or even more clearly, we can use calming. Calm, you need to calm the mind. If the patient comes to you and the patient is late for your appointment, the patient is anxious because they late for half an hour for your appointment, but she really want to have the treatment. So in this situation, the patient will be nervous. You need to calm the patient down. Ask the patient to relax. That doesn't matter for the delay. To calm the mind. In the other situation, the patient suffers from sciatica. So the patient suffers from the pain from the lower back all the way to one side of their foot. I know you said I have studied this from the lectures. This acupuncture works very well in sciatica. However, I need to use 3 needles, which means I need to insert 75 millimeter. So when you take out the needle, the patient see the length of the needle. Patient nervous about the treatment. In this situation, you need to explain to the patient there won't be too much pain, or if they feel too much pain, just let you know you can stop the treatment or slow down the process. Then the patient can manage the pain. That's why before the treatment, it is very important to explain to the patient what to expect. This also can help to cultivate the mind of the patient. So in these 2 scenarios, we actually explaining how to cultivate the mind of the patient. However, the cultivating the mind of the patient, the cultivating the mind is not only refers to cultivating the mind of the patient, also refers to cultivating the mind of the practitioners. Before you perform the treatments, you need to concentrate. You need to calm yourself down. This morning, I quarreled with someone else, so I am very angry. Even while I'm seeing patients, I'm still very angry. In this situation, you should calm yourself down before you perform the treatments. As a practitioners, we have to maintain our mind to be calm at all times when we see patients, especially when we perform the acupuncture treatments. You actually can see in our needling techniques, I always emphasize the qi arrival, the sensation from the patients, the sensation from your fingers. What kind of feeling do you have? You can just imagine this. If you are not calm, how can you distinguish or identify the sensation? If the patient is not calm, how can they tell you what kind of sensation they have? So this is the cultivating the mind. As a practitioner, you see sometimes I receive the emails from some of you. They says, "Hey, Dr. Hu, I'm sorry. I got family issues, so I can't attend the class. I got family issues. I can't write a test. I need to postpone the test." I do understand some situations that we cannot avoid in our daily life. However, as a practitioner, we have to, this is actually the practice. We need to separate our family issues and your practice. If you cannot separate your family issues with your study, you also cannot separate your family issues with your practice. It's going to affect your treatments and your patients. So this is something you need to work on. You need to learn how to cultivate the mind. Another example is in our needle techniques, we learn the proper treatments. For example, how to manipulate the needle, lifting and thrusting, rotating, flying. All those techniques we have studied in the practical sessions. The patient will have very strong sensation. Although we emphasize the qi arrival, that's why I teach you the proper needling technique with the proper manipulation techniques. However, from these techniques, the patient do feel more sensation, feel stronger qi arrival sensation. However, some patients, they're nervous, they don't want this kind of treatment. What can you do? You follow the instruction that we studied in the class. That's Dr. Hu said the qi arrival is very important. So in order to achieve the efficacy, I have to perform this treatment, this manipulation method that I have learned in the class. But you see, in this situation, if the patient is nervous about the sensation, you need to make it softer. You need to make it less sensation. Although the efficacy may be not that good, but in this situation, it will benefit the patient because the patient's mind will be stable. They won't be nervous. If you cause discomfort to the patient, you're disturbing the mind, which means you are not cultivating the mind. It will reduce the efficacy of your treatments. So again, when you think about all these scenarios, you will see that our treatments, even with the same disease, we need to think about the patient's condition, the geography, where they live, the patient's condition, disease, the time of the treatment. So this again, we base back to the basic theory, the principles of the in the treatments, the principles. When we study in the basic theory, how many principles that we need to follow? How many principles we need to consider when seeing a patient? There are 3. The time when the patient comes to you, in which season, the geography, where the patient lives, and the individual's condition, the individual's mental condition, psychological condition, and the disease condition. So all these aspects we need to follow. We need to think about before performing the treatments or during cultivating the mind. There's the last very important aspect is during the treatment, the practitioner need to focus. So from the patient's perspective, from a practitioner's perspective, the practitioner needs to focus. You don't play yourself with your left hand while you're needling with your right hand. You don't joke with your colleagues. You don't talk about gossips during your treatments, especially in the group treatments or the treatments with a group of practitioners, your friends as a joint practitioners. You always talk something else. But this should not happen during your treatments, because once you discuss something else, you are not concentrating on the treatments. This will affect your mind, which also will affect the efficacy of the treatments. So as you can see here, cultivating the mind should be followed during the whole process of our treatments, from the beginning, before the treatments, till the end of the treatments. These are the cultivating the spirits. The second part of this principle, maintaining the qi, this is actually very close related to cultivating the mind, because maintaining the qi refers to the qi arrival, the qi movements, where that sensation goes. Sometimes the patient will feel the sensation. For example, if you insert large intestine 11, sometimes the patient will feel the feeling travel to their hand or to the arm, even to their abdomen. So the movement of the qi, maintain the movement of the qi. The qi arrival to the affected areas. These are very important. If you can achieve this sensation, the results will be very good. If a patient suffers from the wrist pain or the non-tingling sensation in the fingers, if you insert in large intestine 11, if the patient can feel the sensation traveling from large intestine 11 to the hand, from the arm to the from the elbow to the hand, then the result will be very good. Maintaining the qi. In order to maintain the qi, the practitioner also need to be concentrate. The practitioner also need to perform professionally. So as the practitioner, always be patient to your patient, always concerned about your patient's feeling, and always show professional in front of your patient. There are a few factors that may affect the qi arrival or the maintaining of the qi. The patient's conditions or the constitution of the patient, how sensitive the patient will be towards the treatment. More importantly, the accuracy of the acupoints. So your location, how accurate you locate the points. Is it the correct points or the wrong points? The correct insertion direction. So the insertion towards how to insert the needle. Is it through the needle, perpendicular, oblique, or through towards the other points? The direction is very important. The angle of your insertion, the depth of your insertion, the tense and the manipulation method. The tense refers to such as the manipulation method that we introduced in the class. You have to follow the very strong manipulation method, or you need to follow the mild manipulation method. So these are all different aspects that you need to consider when seeing a patient. The depth also very important. If for example the GB30 环跳, you're supposed to use a 3-trin needle. If you use a 1-trin needle, you won't achieve the efficacy because the depth is not enough. Apart from these aspects, there also one aspect is the duration of the manipulation method. How long you're going to keep the manipulation. Sometimes you don't manipulate. Sometimes you don't keep the needle in the body. Sometimes you need to manipulate for 1 minute or even longer. Sometimes you need to repeat after 10 or 15 minutes. So all these are different aspects you need to consider during your treatment. In this video, we mainly talking about the cultivating the mind and maintaining qi arrival. How to maintain the qi arrival? We also can use the technique that we have studied in the Acupuncture and Moxibustion. Those techniques to enhance qi arrival. Cultivating the mind is very important, although it is also essential to create a relaxing environment when seeing patients. The patient, we shouldn't create the stress to the patient. The patient need to be relaxed. But even in this situation, you should not be too casual when seeing patients. Even the patient is your friend, or after a few sessions of follow-ups, you become very close, or you know each other quite well as a practitioner and a patient. You are not suggested to be too casual. So for example, even a very close friend or a very close patient, we should not wear your shirt or your pajama when seeing patients. So as a practitioner, we need to maintain the certain degree of the relationship between the practitioner and the patient. How to create the relaxing environment for the patient. In the meantime, we're still showing our professional towards your practice. In the next video, we are going to discuss some specific principles on the treatments. Thank you for your attention.